for tuning in, and welcome to my first live. Hopefully we have some viewers out there trickling in. We're going to talk a little bit about weight loss before surgery, after surgery, healthy ways of doing that, and then our weight loss patients, people that have gone through either bariatric surgery or now with the medically assisted weight loss with the semaglutides. And then we'll get into just some basic nutrition, things to focus on before surgery and leading up to surgery and immediately post-operatively. So first, let's start by talking a little bit about our weight loss patients. Weight loss now comes in multiple varieties. We have the traditional old-fashioned way of just diet and exercise, and this is ideal if you're able to do that. A lot of people end up not being able to do that for a multitude of reasons, including just ailments, knee pain, back pain, other reasons it's difficult for them to exercise. They just have trouble dieting. But if you're able to diet and exercise, ideal way to lose weight before surgery. When we're talking about that, you really don't want to crash diet before surgery. If you do some crash diet right before surgery to try and just meet a BMI cutoff, so you sneak in under the limit and get in it, you may come in protein deficient and have difficulty with wound healing after surgery. So you really want to plan ahead, get to your goal weight before surgery, and do it in a nice, steady fashion so it's not crash dieting right before. Another big thing, what I just mentioned, your goal weight. Every one of the procedures we do is affected by your weight gain and loss. So you want to get to a point where you're at your goal weight and it's a steady weight that you can maintain. If you come in and you have not reached your goal weight and we do a big breast reduction or a breast lift, and then you go on to lose 30 pounds after surgery, you're going to get sagging again. That's why we really need to get you close to your goal weight so that those are lasting results when you finish up. Same thing with an abdominoplasty. If you come in and you never really get to your goal weight and you have a significant amount of visceral fat remaining, remember visceral fat is the fat that's underneath our muscles that we can't touch with liposuction. Diet, exercise, weight loss surgery, these are the ways to address that visceral fat. If you don't get rid of that, we're not going to be able to tighten up those abdominal muscles. We're not going to be able to give you that awesome result you're really looking for with these surgeries. So get to your goal weight in a nice, healthy manner. So let's go into some of these other varieties of weight loss. So bariatric surgery is near and dear to my heart. I did general surgery before this. I worked with one of the top bariatric surgeons in the country, and I've seen the profound effects that this can have on our patients. And I love what it does for people, not just for their vanity and for looking better, but it helps people live longer. So bariatric surgery comes in multiple different varieties. We have the Roux-en-Y gastric bypass, which is technically called like an malabsorptive procedure, where we're actually rerouting your plumbing a little bit, and you're not absorbing as much nutrients as you're getting. So those patients, my gastric bypass patients, super important for you to take your post-operative vitamins and supplements that your bariatric surgeon recommends and get those levels checked on an annual basis to make sure you're not becoming deficient. That's why we have sometimes patients that come in to get preoperative clearance and we find out their hemoglobin is super low because they haven't been taking their iron. You really need to be taking your iron. You need to be taking all the supplements that you were prescribed because your body is not absorbing those like it did before your surgery. Kind of our second phase evolution of bariatric surgery is the gastric sleeve, which is a restrictive procedure, meaning it's not necessarily that you're not able to absorb your nutrients, but we're restricting the size of your stomach so you're not able to eat as much in one setting. It's also doing other things like getting rid of some of the cells that produce the ghrelin hormone or the hunger hormone. So it's a super effective surgery that I really recommend to my patients that are higher BMI and they're just struggling getting to their weight loss goals. Go out, meet a good bariatric surgeon, and get that surgery. But again, nutrition is very important for this, not quite as important as the Roux-en-Y gastric bypass. Your risk of malabsorption is a little lower, but you still have that risk and you're also just not eating as much. So make sure you're eating a balanced diet and you're taking all the supplements your bariatric surgeon recommends. Now, The new thing that we have, the new kid on the block, is the semaglutides that everybody's talking about. This is the Wegovy, the Ozempic, anything that they're talking about in Hollywood. I see a lot of promise in these drugs. We're still very early on the journey of long-term effects of these drugs. And I just want to tell people, approach it with caution. It definitely is going to help jumpstart your dieting and your weight loss journey, but this is really kind of suppressing people's appetite significantly. It's delaying gastric emptying a little bit, which is a reason why we're going to need to stop that at least 2 weeks before surgery. I'm kind of thinking we should even push that a little bit further, maybe to even 3 weeks, because that delayed gastric emptying can cause issues with possibly aspirating at the time of intubation. So we want to be cautious about that. Also be cautious about your weight loss with those drugs. Again, super effective, they do a good job, but make sure you're taking a high protein diet when you take those medications to maintain your muscle, and also for your recovery after surgery. Protein is what heals all of our incisions. So since we've gotten through some of the weight loss nutrition deficiencies, we need to talk about what you need to do to get to that steady state before surgery. So for my bariatric surgery patients, you really need to get to your goal weight and a stable weight, which is typically a minimum of 1 year after your weight loss surgery. And most patients really start to dip down, they lose their maximum amount of weight, and then they come back up a little bit and stabilize. We want to catch you when you're at that stable portion again, so you can get those nice, long-lasting results after surgery. So, talked about weight loss, we talked about some nutrition surrounding that. Let's talk about perioperative care and weight loss for all of my patients. Again, general supplementation of vitamins I think is great. I think everybody should do it, because with our modern American diets, we're probably deficient in some of our important vitamins and other things. But leading up to surgery, I want everybody to basically stop all supplements at least a week before surgery, typically 2 weeks before surgery, just to avoid any increased risk of bleeding, because snuck into some of those supplements are things that can increase bleeding. Vitamin E, vitamin K, omega-3 fatty acids, these can all increase the risk of bleeding. And since not all supplements are regulated super strictly by the FDA, I just like everybody to stop everything before surgery, so we're decreasing your risk of bleeding. But leading up to it, make sure you're taking your multivitamins, getting that supplementation, and then immediately after surgery, you can start easing back into the supplements. Arnica is something that's been shown to decrease bruising and swelling after surgery. I recommend starting that after surgery. It's definitely something that can help. Collagen supplementation is something I tell my patients to do. Collagen is just a protein, it's a peptide you can get from Costco or many other places. It can help with your skin contractility. So start taking collagen weeks before surgery, continue taking it after surgery, and that might help your skin contract a little bit if we're doing a big liposuction case. Again, talking about stable weight before surgery, my fat transfer patients, anyone that we're gonna do a BBL on, when you come in, you don't want to crash diet or gain weight before surgery. You wanna be nice and stable at a place that you're gonna live after surgery, because whatever you're doing to that fat to maintain it on your belly, we wanna continue doing that to maintain it when we transfer it to your butt. So after surgery, just really stick to a similar diet to what you were doing before surgery, maybe increase your protein a little bit, but we want to maintain those results. We don't want to lose fat, so don't change up your diet too much for the first few weeks after surgery, after a fat transfer. All right, and then covering a few different things here. I don't know, Willie, do we have any questions funneling in yet?
Yes, we start
All
having
right.
questions, and we have a lot of people here. So there are greetings for Dr. Natalia Vidal and
Okay.
from Danielle Wigrid. Say hi.
Oh, yeah.
Okay, let's start. Doc, could you tell us about your age limit for procedures?
Yeah, so for procedures, for our age limits, this is all about patient safety and also what patients are going to get a reasonable result. So that's the reason why we impose these age limits. So for patients that are looking for liposuction or BBLs, anything like that, that age limit, or mommy makeovers, really big, rather invasive surgeries, we're going to stop at 55 years old. And then I can do more simple procedures up to age 60. And then sometimes on a case-by-case basis after that, if you're a really healthy person and you just want breast surgery or something else, we can go beyond 60, but for the most part, my age limits are 55 for big liposuction cases and big mommy makeovers, and then 60 for everything else.
Could you explain about the BMI limits?
So yeah, my BMI limits, again, safety is the reason why we impose these limits, and then also just getting you the result that you want. So basically my BMI limit across the board is 34, okay? So you have to be a candidate for whatever we're doing. If you come in with a BMI of 34 and you want a liposuction case and you're expecting that your skin's gonna contract right up and you're not gonna have any loose skin, we're gonna have to have a conversation about that and possibly talk about alternatives, but 34 is my cutoff for everyone, and obviously with otherwise healthy patient and a medical clearance.
Are you using the Vaser Lipo too?
I have not started using it yet. We just got it at Pure Plastic Surgery. Dr. Earl's getting into it, but I look forward to using it in the very near future.
Okay. How long after breastfeeding I can go for a breast augmentation?
All right, so this is a minimum of 6 months after stopping milk production. So if you were breastfeeding and you stopped 6 months ago, but you still see milk occasionally coming out, we got to reset the clock and wait till 6 months after milk production, because there's a risk of you getting what's called a lactocele, where you produce milk in almost a cyst form after surgery. So at least 6 months after milk production.
If you have anemia, is possible to do any procedure? Intake iron already.
Say that again?
If I have anemia, is possible to do any procedure?
No, not necessarily. We need to see what your hemoglobin level is. We need to see what we can do to optimize that. Like I said, a lot of patients come in with iron deficiency, and as simple as giving them some iron supplements, we can bump up that hemoglobin level. And then we also have a great tool here at Pure Plastic Surgery, which is called the Cell Saver. So depending on where your hemoglobin level is, we may elect to use the Cell Saver, where we can actually recycle the blood that's removed and give it back to you through the IV.
What's the last question, Doug? If you can remind about the breast promotion we have?
Yeah, everybody, we have an awesome promotion for Breast Cancer Awareness Month, which is for the month of October, and we're offering 10 sets of free Allergan implants to the first 10 patients that sign up for surgery that requires implants for the month of October. Thank you all for joining my first live. Look forward to seeing you all again next Thursday.